Hi friends, I am Sudhar sir. I am going to give you lecture on Parkinson disease. You know that what is Parkinson? Parkinson's is nothing but is a mental disorder is there in which the person is there is not having control on his body. Most of the arms are there, then heads are there, legs are there on this one particular position. These persons are there that is not having any control. That is involuntarily the organs are there that are to be moved, such as the hands are there that are shake in this one particular manner. So I am going to show you that how the hands are there that is move just like this. The hand is there that is we move just like this one. Means there is a involuntarily when the person is there that is we perform the something work, the hand is there that is we in this one particular motion the hand is there is we having, then heads is there is also moving continuously at your home. Most of the old patients are there that are having such type of the habit. They are shaking their hands frequently, or they are shaking their neck or the head is there that is be shaking while talking this one particular thing, that indicate that these persons are there that are suffer by the Parkinson's. This Parkinson is there is mostly occur because of the imbalance in the dopamine level. Now we see that what are the different examples are there that is of the Parkinson. Here this is the person is there where the hands are there that are shaking continuously, where there is slope posture is there should form in this one particular Parkinson disease. There is a difficulty to maintain the straight position, so that they have having some slow position, whereas the head is there that should be continuously move in the upward as well as the downward direction. Such type of the condition is there that should happen. Along with that, these people have somewhat difficulty while speaking also. The toning is there is not clear in such type of the patient when their hands are there or the heads are there that are in a sitting position. They show there is a continuous shaking action. That is the asymmetric resting is there, or the tremors are there that is we observe in such type of the patients. This is nothing but is a Parkinson's disease is there. That is a brain disorder because of the dopamine imbalance in the dopamine level. Now I here show you link there I have mentioned you. If you have to click on this one link, you have to observe the video clip of the Parkinson's. Now in this disease, the forward tilt of the trunk is there at form, then reduced arm swing is there at shops, and then stepping gait with the short steps are there. Means while walking, we have to move as per your regular distance in the feet is there. But these people are there that are very difficult to maintain their balance, so that they have to place their feet on a shorter distance. This is because of the they feel a difficulty while balancing their body, so they have to place their feet in a shorter distance of the shorter distance. So sometimes they also show the stiffness in their legs are there that is found in rigidity in trimming of the head. Likewise, the things are there that are to be observed in case of the Parkinson's disease. Here I am showing you that the brain portions of the healthy person is there, healthy patient, whereas this is the Parkinson's patients are there. This is the dopamine levels are there. In case of the healthy patient, the transmitting the neurons through the dopamine to the receptor cell is there that should be carried out by the dopamine. But in case of the Parkinson's patient, the dopamine level is goes on decreasing, so that the transmission of this one neurons to the receptor cell is carried out very slowly or very uh, less. Now the next one is there, that is a Parkinson disease. This is the first described by the shaking palsy by James Parkinson in 1817. This is the first person in there who searched this disease by. There is a shaking there that she found, so that shaking palsy motion is there that she found by this one particular scientist, and he described or gives name, that is a James Parkinson gives name, and because of this, the disease there is known as a Parkinson. Then Jean Martin Charcot proposed its current name, that is a honoring James Parkinson, means that Hormones is there that she carried. The Parkinson is there that is known by the various name. In short, we are the pharmacy people, so we know that the alternative name. In short, we call it as a synonym. That is a Parkinson disease is there. Then idiopathic or the primary Parkinson's is there. Then hypokinetic rigid syndromes are there. That is a second one. That is a paralysis agents are there. Likewise, these names are nothing but the disease that is the Parkinson's. Now, Parkinson disease, in short, it is known as a PD, not pen drive. That is a Parkinson disease. It is a chronic neurodegenerative disease is there. That is a brain disorder is there that is be associated with the sustainable morbidity. Means what is the disease condition is there that goes on increasing and increased mortality. Means because of that the death is there that is also found near about 1% population is there that is will suffer by this disease, and the mortality is there is also about 1%. The higher economic burden is there, the treatment is somewhat costly, and so that economic burden is there is somewhat high. The incidence of the Parkinson's is to be increased with the age, but estimated 4% people with the Parkinson disease are diagnosed before the age of the 40. Nowadays is there very stress conditions are there, and it's very difficult to adjust all these things, so that in because of that the Parkinson disease there is to be found before the age of the 50 years, and most of the peoples in most of the uh, peoples, the males are there that are suffer near about 1.5% of the males are there that are, or 1.5% more times male are suffer than the female of the Parkinson disease. Now, the symptoms of the Parkinson disease are there. Initially, I told you the what is the shaking of the hands are there, then hanging, uh, shaking of the head is there, speaking problems are there, slip of the tongues are there, or what is the pronunciations are there, or the tones are there that are not clear, and they are having a very difficulty while walking. The stiffness in the legs are there. Likewise, the different type of the symptoms are there. Now we see that another symptoms one by one. Now, in case of the symptoms of the Parkinson disease, there is a primary motor symptoms, secondary motor symptoms, and non-motor symptoms are there. Here, you show that this is a figure is there in this one figure. What are the neurons are there that has to be transferred to the receptor cell by this one dopamine. The concentration of the dopamine is there is to be high or sufficient. We can't say that the normal one, so that the easy transfer is there is to be carried out, and the control is there is to be carried out on the particular organs. But in case of the Parkinson disease, the very less amount of the dopamines are there that are present, so that there is no control message if there is not to be transferred to the particular organ, and so that the movement disorders are there that are to be observed. This is the reason why the Parkinson is occurs. Then, in primary motor symptoms, the Parkinson symptoms are classified as a primary motor symptoms, secondary motor symptoms, and non-motor symptoms. In the primary motor symptoms, the various factors are there that plays an important role, such as the resting tremors are there, by which you can see that patient is suffered by the primary motor symptoms. In this case, there is shaking of the hand, arms, or the leg, especially when the limbs are at a rest position. When this patient is there is to be sit or in a relaxed condition, they don't know their arms are there that are shaking, hands are shaking, or legs are shaking, or sometimes the neck there is also shaking condition, because these are the involuntary, the action is there that is being done. There is no control of the brain on this one particular activity is there, so that it is known as a resting tremor. Next one is there, it's a bradykinesia is there, that is a gradual loss and the slowing down of the spontaneous movement. In the first slide, I told you that whenever the person is there, as you move, such as a Parkinson person is move, he had to place the distance between the two feet if there is very short, because there is a fear in such type of the patient's mind that he fall on the ground. There is because of the imbalance. so that the condition is there that we have found. Next one is there, that is a rigidity, an abnormal stiffness in a limb or the part of the body. There once the persons are there that are sit, just like rheumatoid arthritis, it's very difficult to re-get the different position while sitting to the standing or standing to the sitting position, because of the stiffness of the limbs are there, that is a rigidity is there. Then the postural instability, that is a balance problems are there. The this is mostly occur because of the impaired balance or difficulty in case of the standing or walking. Brain is not having a total control on the such postures, or the we can say that the muscles. So such type of the problems are there that we appear. Then walking or great problems are there. The bradycardia as well as the posture instability both contributes. In this case, there is a bradycardia, cancia, as well as the posture instability both contribute to walking or gait difficulty. In case of the Parkinson disease, means such type of the patients are there that are unable to walk or stand a single, so they requires always a chair as well as a support right there that is required. Now, the secondary symptoms are there, that is the shuffling gait, that is a rhythm of walking. Such type of the patient, while walking, they are not having a particular posture. There is an imbalance in there that is you found. Such the legs are there that are not in a proper position to control the body's weight. They are not having somewhat strain to control this one. We can't say that the weakness is there because of this is happened, but the patient is not having a total control on that one particular organ. We can say that legs. Then micrographia is there, that is abnormally in the small or the cramp in handwriting. Mostly you have to be observed that the patients are there, if they are trying to write or even the sign some document, they shake their hands, just like some of the alcoholic drinkers are there. Without drink, they are unable to perform any type of the activity. If they want, if you ask him without drinking, just have to perform the same activity, then they show shaking of the hand, their shaking of the necks. Such type of the activities are there that is found. Then the same one conditions are there that she found in case of this one Parkinson's patient. There the shivering are there that is found, or the cramps are there that is found in the hand, so that is very difficult to write this, and the handwritings are there that is also not proper one. Mass like expressions are there that is found in such type of the patient. Then speech difficulty while speaking, the slip of the tongues are there, or the pronunciations are there that are not to be clear, just like wow, such type of the speakings are there that is found in such a case is there. Okay. Now the secondary motor symptoms are there, that is a dystonia, that is a painful muscle cramps are there. There is a much more cramps are there and having a pain in this one. Legs are there or the hands are there. In so it's a condition is there that is known as a dystonia. Then stop posture, a tendency to lean forward. This is mostly found. They try to move forward, but their organs are there that are not going to give support. Such type of the condition is there is known as the stop posture position. Means within a next second they are move forward, just like postures are there that we found. Then impaired fine motor uh, dexterity and the motor coordination. There is no total control of the brain, but the message which is transferred by the motor neuron from the brain to the particular organ, that is not to be happen because of the deficiency of the dopamine, so that brain is not having any control on that particular organ, or very less amount of the signals are there that are to be transferred to that one particular organ. So such type of the condition is there, issue occur. Next one is that is the impaired gross motor coordination is there. Means in above case there is somewhat less amount of the message is there should be transferred because the less amount of the dopamine is actually present, but here there is no dopamine is present, so that there is no any transfer of the message that we carried out. That is a impaired gross motor condition. That is next one is that is a sapling grade. That is a rhythm of walking. In the last slide also I told you that the walking condition is there is not proper. The legs are there that are not holding the body position in a proper way. The slips are there. Slips of the legs are there that are not to be occur. Then reduce movement, decrease arm swings are there. Arm are there that are unable to perform the functions, and swing is there that is very less. Means uplifting of the arms are there that is not to be possible, or to hold a particular position. If you ask to hold a cup for by this one particular patient, it's very difficult to hold this one cup also. Then akastia, that is a tendency to keep moving. There's a continuous shaking there that is be found in such type of the patient, because this is the involuntary movement is there that you occur. Involuntary means there is no any control of the brain on this one particular motion is there that is be found. uh, then speech problems such as the soft voice, or the we can say that slurred speech problems are there that is we observe. Recently I told you that how the toning is there that she found. Then soft voice is there, means two words are there that are to be mixed up with each other. Such type of the conditions are there that are found in such patient. Then reduce swallowing movement, causing drooling as well as the excess saliva is there. Then difficulty in swallowing condition is there. When such type of the patient is try to drink or eat, the saliva is there that issue comes out from the mouth, because there is no control of the brain on this one particular activity. So saliva may comes out from the mouth also. Then sexual dysfunction, as we see that the overall the problems are there, so that this is the most common problem is there, where such type of the functions are there that is not to be performed. Then cramping are there, sometimes cramps are there that are to be found because the hands as well as the legs or the arms are there that are in a continuous shaking condition. So because of it there is a cramps may occur. Then micrographia, that is abnormally small or the cramp hand writing is there that is found. That is a micrographia. You know that the micrographia means just like that ECG, how the ECG is there, how the language is there, just like that the handwriting is there that is to be found in such patients writing. Mass like expressions are there that are to be found. This is nothing but the secondary motor symptoms are there. Now the next one is there, that is non-motor symptoms. The Parkinson experience, that non-motor symptoms are there that do not involve the movement, coordination, physical task, or the morbidity. It means continuous development of the disease there is not to be occur. The early symptom, that is a loss of the sense is there, that is a smell. Such type of the patient is there is not having or perceive the smell. Uh, Even a normal person even easily say that the tea is going to be prepared, or this is the flavor of the lemon is there, orange is there, but or some of the irritating smell, such as the eucalyptus oil, in Marathi we call it as a nilgiri tel. You can easily pursue the smell, but such type of the patient can pursue the smell. Then patient always have a problem of the constipation. Then rapid eye movement, that is a REM behavior disorder, means at the sleeping time, the eyes are there that are having a continuous movement is there that she found. And then mood disorders, means in this one particular case the patient is not having a mood also. They are always having a problems with something. Likewise this is known as a mood disorder. Then orthostatic hypotension, and the blood pressure when standing up, that is a orthostatic hypotension condition is there that is found. Then other non-motor symptom that is to be also same as that type of the early symptoms are there. Okay, now the same one slide is there. What are the in the previous slide I told you the early symptom, that same symptoms are there, that in case of the non-motor symptoms are there, that is a loss of the sense is there, constipation is there, then rapid eye movement are there, that are to be found in this one, that is a other non-motor symptoms. Now the next one is that is a pathogenesis of the Parkinson disease. Now, in case of this one, these are the reasons are there why the Parkinson disease is there at issue occur, or these are the conditions are there by which the Parkinson disease is there at issue occur. That is a free radical, then deficit in energy metabolism, deficiency in the energy which is required for the metabolism. Then program cell death. This is the second reason is there. Then genetic factors, then environmental factors, then protein aggregation, aging, drug-induced Parkinson's are there. These are the pathogenesis are there. Means these are the factors which are to be responsible to cause Parkinson's is there. Now we see one by one. Okay. Now, whenever the genetic deposition means the genetic factors are there that is should be transferred from one generation to another generation. This is the first one, second one age factor, then third one environmental factor, sometime iron, and the exotoxicity. When all these factors are there that are to be combined together, and they act or they causes the mutation and deposition of the alpha synuclein that induce induction of the Levy bodies and deposition of the neuromelanin. Uh, Deposition of the neuromelanin is there should be carried out, as well as the mutation and the deposition of the alpha nucleosin is occur. Why this is to be occur? Because of the genetic factor, then age, environment is there, ions are there, then exotoxicity is there. Then what it causes? They causes the microglossis, then mitochondrial dysfunction. What is the normal function of the mitochondria is there, that is should be disturbed. Then inflammation is there should be occur. Then generation of the reaction radio reaction oxygen species are there, reactive oxygen species are there that are to be generated, then because of which on both the side they show their action, just like that. On one side they show the oxidation oxidative damage of the DNA, means what is the DNA is there, lipids are there, proteins are there, there is oxidation is there is to be carried out, and because of the glutamate stimulating hormones are there, loss of the glutamate stimulating hormone, glutathione, which is to be acting as a biomarker in case of the Parkinson's disease, and if there is loss. Whereas in second one there is a alteration in the dopamine, means dopamine level which should be required, that is the deficiency there that is found uh, because of the alteration. Then metabolism redox, as well as the arousal transport dysfunction is there is occur, and because of these two conditions, this one oxidative damage as well as the alteration in the dopamine, that causes the induction of the apoptosis and other abnormal movement, and that leads to the Parkinson's disease. Okay. In this way, this is the pathogenesis is there. In short, we have to be studied. Now we say that one by one the factors. In that first one factor, that is a free radical, and there is a deficit in the energy metabolism. Means because of the free radical, the energy metabolism is there is not to be occurred. There is a which is to be occurred. The free radicals such as your hydroxyl radical is there, then superoxide radicals are there, nitric oxide, then other molecules such as your hydrogen peroxide is there, then all these radicals are there. Along with that, pyroxynitrite are not, this is not a free radical but can lead to the generation of the free radical. Because of that, the free radicals are there, that is also generated through the various chemical reaction that is to be involved in the various step of the chemical reaction, and because of the free radicals are there that are to be generated, that we see that the hydroxyl radicals are there, superoxide radicals, nitric oxide radicals are there, then hydrogen peroxide is there likewise. Because of the free radical dopamine as a relatively unstable molecule. Dopamine is there is not a stable one; it is an unstable one molecule in nature. It undergoes auto-oxidation itself. In case the oxidation metabolism is there should be carried out in the nitrostatic real state system, thereby producing the reactive oxygen species are there that are to be produced. That is the free radical depicts in the energy metabolism. Now, how this free radical depict metabolism is there is occur. Now we see this one just like that. What are the free radicals are there that are to be produced? This free radical one that are to be produced because of the different type of the chemical reaction that causes the proteins such as the thiol oxidation is there. Oxidation of the thiol is carried out, and because of which the carboxyl formation is occur, and the activation or the deactivation of the enzyme means some of the enzyme which are not to be active one that becomes activated, some of the enzymes which are inactive one that becomes active. This is because of the free radical. Then lipid pair oxidation is there should be carried out because of which damage to the membrane is occur. This why this is to be occur because of the free radical. Free radical it causes the peroxidation of the lipids, and once the lipids is get peroxidized, it causes damage to the membrane. Then free radical it also causes DNA. It causes alteration of the gene expression because of which depletion of the ATP and NADPH is occur. And once these proteins, lipid, DNA is there should be altered, it causes cell injury, and that results in case of the inflammation. When the inflammation is there should occur, the reactive oxygen species level is goes on increasing, and because of which nuclear factor erythroids, that is nuclear factor B and nuclear factor 2, that are to be generated, and that results in case of the mediated gene expression, then neurodegeneration mean degeneration of the neurons is occur, and that results into the symptoms of the Parkinson's disease. As you know that is once the free radical is generated in the previous slide, that causes free radical, it causes the disturbance, it causes disturbance to the protein, lipid, DNA, because of which cell injuries occur, because of which uh, the active oxygen species level is goes on increasing, which causes the nuclear factor erythroids. And this nuclear factor erythroids, that is the gene expression, it causes the neurodegeneration, and that results in case of the symptoms of the Parkinson's disease. Now the next one is there, that's a program cell death is there. Dopaminergic degradation in the substantia nigra may cause Parkinson disease. Now how it causes? The healthy cell is there, then this healthy cell it causes the capsid. Some of them are there that are capsid dependent, some are there that are capsid independent. Capsids are nothing but the cysteine aspartate protease. These are the enzyme, that is cysteine aspartic protease are there. If they are to be capsid dependent one, that results into the apoptosis process, that is a Parkinson disease type 1 is there issue be occurs. Then if they are independent, then autophagic cell death is occur, that results in case of the Parkinson's disease type 2. If there is a necroptic is there, or the necrosis is there should be occur, that results in case of the Parkinson disease third. The caspase are the family of the protease enzyme. Means this is the one of the enzyme is there that plays an essential role in case of the program cell death. Means to kill this one cell, this is special program is there. In that case, that plays an important role, including the apoptosis, then protease is there, then necrotic is there, and the inflammation is there is occurs. Okay, this is the program cell death is there. You understand this one? In case of the program cell death, there is a healthy cell either either Parkinson disease occur because of the capsid dependent, means because of that enzyme dependent, or the independent dependent, that result in case of the apoptosis, that is a Parkinson disease one. If they are independent, it results in case of the Parkinson disease 2 or Parkinson disease 3. If two is there, that is a autophagic cell that is occur. If Parkinson's is there, that is a necroptosis is there is occurs. Likewise, the conditions are there that should occur. That is in case of the Parkinson's disease. Now the next one is there, that is the environmental factors. How these environmental factors are there that are to be affected, as well as the genetic factors. Increase risk. Sometimes the pesticide exposure are there. Some of the farmers are there that are utilizing the pesticide. They remain much in much more contact with this one pesticide, or they are to become in the exposure while in the field, so that the pesticides shows their adverse effect on this one uh, farmers, and that relates to the Parkinson's disease. Then prior head injury, sometimes if the patient or the patient is having somewhat injury to the head, then rural livings are there, so they are not going to take much more precautions. They are not aware about this one, how to what are the nutritions are there, then which type of the food materials are there that you have to take, which type of the precautions we have to take, so they suffer by this one. This is because of the rural living are there, then beta blockers. Some of the patients are there that are hypertensive ones, so that in that case the beta blockers are there that are to be given, so that is also suffer by the Parkinson disease. Then agricultural occupations are there, different type of the chemicals are there that were to be utilized, so that may come in contact with this one, that leads to the Parkinson disease. Well, water drinking, some of the person is having habit to drink water where the heavy metals are there that are to be present, ions are there that are to be present in a higher concentration, and because of which the patient is there is to be suffer by this one Parkinson disease. Then decrease risk, this is the increase risk in case of the environmental factor. This is the second one is there, that is a decrease risk, that is a tobacco smoking is there, that issue occurs. Some patients if there is having habit to smoke tobacco, uh, so that there may be the this one Parkinson disease is there, that should be decreased coffee drinking, as a CNS stimulant. Then NSAID, non-steroidal anti-inflammatory drugs are there that are to be used. They decrease the risk of this one. Then calcium channel blockers are there that are to be used. Alcohol consumptions are there. I'm not saying that you have to protect yourself from the Parkinson disease, you have to drink alcohol, but those person who are having habit, they are having less chances to suffer by this one. This is the decrease risk is there. Then interaction is the increase, this is the genetic factors are there, GPA. Likewise this one factors, it shows the increased risk is there, that is a, these are the ways short terms are there that are to be utilized. Then decrease risks are there, that is SNA is there, then MAPT is there. Likewise the different terms are there that are to mention, that indicate that this is a decreased risk of this one particular disease are there. Now the next one is there, that is environmental factors are there. In the repeated, if there is a repeated injection of the MPTP, that is a 1-methyl 4-phenyl 1236 tetrahydropyridine is there. In short, we said that that is a methyl phenyl tetrahydropyridine which causes Parkinson disease. Second one is the rotenone. As a pesticide for the different type of the pest, we are going to use rotenone as and paraquat to protect our farm or at the home, also to protect the grains. We are going to use this one rotenone as a pesticide, but least because of the oxidation as well as the nutritive stress, which leads to the greater risk of the developing the Parkinson disease because of the chemicals which are to be released that are responsible to cause Parkinson disease. Then next one is that is a smoke, and the coffee drinkers have been associated with a low risk. If the peoples are having a habit to drink coffee or the drinks are there, in coffee there's a caffeine is there, we're getting nicotines are there that you obtain by the tobacco, so that there is a very less risk is there. So because there is always stimulating agents are there that are to be consumed by this one way, so that there is a very low risk of this one particular disease is there. Now next one is there, that's a protein aggregation. You know that the importance of the protein, what they plays an important role in case of the various type of the processes are there. Then proteins are essential. It plays a diverse role in all the living organism. Various type of the activities are there that are placed by the proteins are there. Then protein holding aggregates through the several stages, eventually assembling into the fibers. In the case of the fiber, that protein plays a important role. Here we have to be observed that is amyloid is there, then tau proteins are there, then alpha sin nucleus is there, then pyron is there, then transferrin is there. These are the different type of the proteins are there, which plays in important role in case of the Alzheimer disease. Then some plays important role in case of the Parkinson disease. Then Marco, I show here by arrow. In case of the Alzheimer disease, these two proteins plays an important role. In case of the Parkinson disease, these three proteins plays an important role. In case of the mad cow disease, these two proteins, one and this is the second one protein plays an important role. Then trans hydration amyloid disease, here this one plays an important role. The protein aggregation can be toxic one. The non-functional protein, if they get aggregates, that can be a toxic one. Then all misfold proteins share a common structural feature is known as amyloid fold is there. In this case, you have to tell that the proteins are important. They have uh, control on the different type of the disease, such as the Alzheimer, their Parkinson's is there, then medical disease is there. Some of the proteins are there that are non-functional one. If they aggregate, sometimes it may cause a problem. Then all misfold proteins share a common structural feature is known as amyloid proteins are there. Is there. Okay, next one is there, that is age. Every time we say that as the age is increases, most of the diseases are there that are to be found, but it is not like that every age person is suffer by this Parkinson disease. If you are having a habit of exercise, then to maintain a diet, to take a diet or the medicines, then you are not suffer by the any type of the disease. But some are having this one. Age is not likely to play a direct role in the degenerative process, but increased age means if your age is there is more than 70 or 80, in that case, ultimately you come in the contact with such type of the diseases are there. Possible role of aging in the pathogenesis of the Parkinson disease is usual occurring in the late middle age, that is lost with the age of the statal DA, and DA of the cell in the substantia nigra is there. Now the next one is there, that the aging is there. In this way, we see that how the aging is plays an important role. In case of the aging, there is a oxidative stress is there. If we observe oxidative stress, then respiratory deficiency is there, then mtDNA deletion is there, then calcium handling is there. Sometimes the calcium losses are there that is we occur because of that. Softness is there, we occur. Then iron components are there. Then neuromelanin accumulations are there because of the oxidative free radicals, the neuromelanins are there that is occur, and this causes somewhat deficiency of the important functional component. Whereas the protein degradation, that protein degradation, it causes the mitochondrial dysfunction, so that the that is very difficult to maintain this one. And because of this one, the symptoms of the Parkinson disease occur. Then mitochondrial genes are there that is we disturb degeneration. Then alpha synucleins are there. All these factors are there that are greater ones, so that the weight is there that is we shifted towards the symptoms of the Parkinson's disease if there is occurs. Now the drug induced Parkinson's are there. Many drugs it causes Parkinson symptom. These effects usually reversible one. Some of the drugs are there that are causes this one. It is not like that every one drug causes Parkinson, but if you are going to take some drugs, for long-term treatment, it may causes the Parkinson disease. The most important drugs are there. That is the butyrophenones are there. Then phenothiazines are there. Then antipsychotic drugs are there, which blocks blood dopamine receptors. Dopamine, you know that the dopamine receptors are there. That is very important one. If there is a deficiency of the dopamine is there, then uh, you are suffer by this one particular disease, that is a Parkinson disease. But if there is a dopamine usage present, but the receptors are there that is not present, then you also suffer by this one Parkinson disease, because the antipsychotic drug that causes the uh, degradation of the dopamine receptors are there. Just like that, collapse is there is not to be occur by one hand, means dopamine and the dopamine receptors. These are the just like your two hand, both are there that is to be required at high dose of the reserpine. Uh, it also causes the similar symptoms simply by depleting the brain dopamine. Now, drug-induced Parkinson. These are the some of the drugs are there that which causes the Parkinson's. This is the classical, that is a typical antipsychotic drugs are there. That is a chlorpromazine is there. Then clorazepam is there. Then haloperidol is there. This type of the drugs it causes the Parkinson. Then atypical antipsychotic drugs such as your uh, risperidone is there, then uh, atropazole is there. Likewise, the drugs are there. Just you have to read this one. Dopamine depleters are there. That is a reserpine is there. Then anti-emetic drugs are there. That is a metoclopramide is there. That also responsible to cause Parkinson disease. Calcium channel blockers such as your flunarizine is there. Likewise, the drugs it causes this one. Okay, the drug frequently causing the Parkinson's. If you have to utilize this drug commonly, clozapine is there, then creatine is there, lithium is there, valproic acid is there, phenytoin is there. That is responsible to cause Parkinson. In this way, we have completed this one chapter, that is a Parkinson disease. I hope you understand this one. Okay, thank you.